Hello, everyone. We meet again. I'm Samson. For some of you, we just tune in. Thank you for tuning in. We are still with chat with Sergey session. Now we have our next guest, which is Professor Dr. Tay Kim Kwan. She's the Dean of Faculty of Pharmacy at Sergey University and Colleges. Professor Tay, thank you for being with us. Thank you so much.
Thank you, Samson, and good morning to everyone. Yes.
Yes, Professor Tay, the audience and us, we would like to know a little bit more about yourself. Can you share to us about yourself? Thank you.
Sure. Okay, as you all know, I'm the Dean for Faculty of Pharmacy. I've been a pharmacist since the year 1991, graduated from UK, did my PhD in UK, and also worked in UK for many, many years in the various pharmacy practice area. I work in hospitals. I work in the Brooks the Chemist in UK. That's the largest chain store, if you all know. I've also worked for drug companies, and eventually I was headhunted by a Malaysian company to come back to work in Malaysia. So I returned to Malaysia eventually. Also worked in various areas of pharmacy practice, from community to research and development, and then eventually headhunted to go into academia. Very much so because of my experience in the various pharmacy practice areas. Because for education, we're preparing graduates to work in various pharmacy practice areas. So it's actually very important in terms of program management to have someone who have, I would say, insight into the various requirement of the industry. All right. So I have been in education for almost how many years? Let me think. I think almost 16, 17 years.
Oh, that's really long.
Yes. I've been in Sergey coming to 13 years.
Oh,
okay.
all right.
And previously I was in another institution. That was my first education experience as academia. And I think because of my experience, so I think when I joined academia, and between 3 months, I was made the program coordinator as well as head of department. So I actually started the program, and when I came over to Sergey, also I started the Bachelor of Pharmacy program.
Oh, very good.
So it's basically, starting from scratch. And so it is a program that I'm extremely proud of.
Oh,
because,
nice.
I think if you talk about pharmacy program in general, it's not just about giving students pharmacy knowledge. To me, as a pharmacist or a competent pharmacist, skills and application of knowledge is very important.
Oh, very nice.
Yes.
Yeah, thank you so much, Professor Tay. Thank you so much. Ladies and gentlemen, audience, our guest here is a person who not a good academician. She also have many years of working industry of experience. Thank you so much. Yeah, Professor Tay and the audience, the title of discussion today will be Untold Secrets About Pharmacy Degrees. Don't make the same mistakes. Yeah, Professor Tay, the first question will be, there's a new circulating in Malaysia that there are so many pharmacy graduates who are unemployed, due to high number of graduates. Is it true? Do pharmacy graduates ended up working in retail outlets such as Watson and Caring?
Okay.
Can you advise on this matter? Thank you.
Okay, I think that is always a question. A lot of people think that there are oversupplies of pharmacists in the country. But if you will look at, I'm just talking about Sergey graduates per se. I do not have any graduates that are out of job.
Oh, that's brilliant.
Yes, I would say, apart from those who intentionally wanted to take gap years or decided not to venture into working as a pharmacist, I would say all my graduates are actually working, and most of them secure a job, very soon. Some even as soon as within 3 months after graduation, and some even as a final year student will be sent out of placement. They have been offered jobs already. Okay. So those who are actually waiting, not having a job immediately, are those groups of graduates who want to work in the public sector. Because public sector, the job application, you have to wait for SPA to open up the vacancies.
Right.
And they normally open up, let's say my graduates complete their studies in around August. SPA normally the first opening is around November. So there's a few months gap for them to wait for that application.
They have the window period to apply. Oh, exactly. Very good.
So I wouldn't consider this is because there is no job demand, but it's because that is the system that that is set as this such a way. Okay, but those who wants to go into private sector, I would say the minute they get their completion certificate and all this, they will start work.
Okay.
Yeah. So, and if you talk about job demand, as a current situation, I will tell you there are still plenty of job opportunity around.
Okay.
So, if I were just to touch on the three main sectors where pharmacy graduates like to work, that is hospital pharmacy, community pharmacy, also called retail pharmacy, and drug companies.
Okay.
These are the three main areas where graduates choose to work.
All right.
So if I look at the job demand in the public hospitals, okay, I think the COVID pandemic is a very good example to tell us, the demand for pharmacists or healthcare professionals, including doctors and dentists. There was a critical shortage of healthcare workers, including pharmacists.
So you're telling that we have a critical shortage, yeah?
Okay, for a public sector, I wouldn't use the word critical, but definitely there is demand. Okay, if you look at the number of public hospitals and private hospitals that are being set up, as well as expansion, if you look at a lot of private hospitals are also expanding their services, the demand for pharmacies is definitely there. Okay,
that's nice.
Because our current healthcare system, initiated by our government, we want to penetrate, access to healthcare services to all members of the society, especially rural area. Okay,
that's brilliant. Yes. So everybody have an equal treatment. Yeah, exactly. Right.
Okay,
right.
So that broad access to healthcare services is very, very important, and with that, definitely the demand for pharmacy will be there. So yes, and again, if you look at private hospitals, they do not actually have a lot of our so-called pharmacy services or clinical services in the hospital setting. And if you look at private hospital, to actually be competitive and with the cost that patients are paying, they have to offer also a very good, a good range of services like public hospitals.
Okay.
All right. Otherwise, a patient would choose to go to public hospitals for better treatment, access, and services. Right. So if they want to remain competitive in business, they definitely have to offer this range of services.
Oh, very good. So the rumors is not true then. Yeah.
I wouldn't say it's true. And if I were to take community pharmacy as the next, high demand, area where pharmacy would like to work. A lot of chain pharmacy, especially, are expanding their business. They're opening a lot of outlets, especially in the rural areas. Okay. And if you look at the fact that we do not even have like 24-hour pharmacy services, but community pharmacy, most of the community pharmacies are actually concentrated in like Klang Valley or certain states like Penang. So there are many other states, if you talk about Kelantan, Terengganu, and all these, the number of community pharmacies are still lacking. So a lot of chain pharmacy are also expanding their business into all these, every corner of the country.
It's mushrooming actually. Yes. Yeah.
So if I look at the recent, requests, we have a few chain pharmacy that approach us. They actually wanted graduates to join them because they're expanding and very fast.
So Professor Tim, then we are talking about shortage now then.
Yes.
Of course. It's not overcrowded or pharmacy. We have shortage now. And
I would say it is a shortage.
Yes, right.
Yeah. And if I were to move on to the other sector, drug company or so-called pharmaceutical company where they manufacture drugs and all this, the demand has always been there because you see with the current economic crisis as well as the cost of imported medicines being so expensive. So we have a booming industry here where manufacturers, drug companies are making generic drugs, which are actually a lot cheaper. And if you look at the supplements, the demand for supplements, look at COVID pandemic. You went to pharmacy, the shelves are all empty because the drug company can't even make the supplements quick enough to replenish the shelves. And when you talk about drug company, why they need pharmacies? Because you talk about quality control, you talk about product registration, you talk about research development and all these. You need a pharmacy.
Oh, there's so many things, so many areas that the student can go in.
Yes, that's why you see being a pharmacist is actually very versatile in that sense. Okay.
Just to ask another further question, Professor Tay, is it so rewarding for a candidate to go into community pharmacy?
I think we wouldn't say. I think to me, every area of practice is rewarding. Okay. Yes, because being a pharmacy, you're being so versatile. You can actually, with the knowledge, the skills, and everything that you have, learned and you can practice. You can briefly go everywhere. So whether it's community pharmacies, it's rewarding as a career. Dealing with patients' health, disease prevention, and so on. Or you go into drug company, come up with new drugs or new formulations. It's all equally rewarding.
Oh, that's brilliant! Yes. Yeah, there's so many options for students when they graduate.
Put it this way, I never regretted being a pharmacist.
Oh, nice!
When I wanted to do pharmacy, my mom was like looking at me, "What the hell is this?" But I have never regretted.
Nice. Audience, to answer your questions here, there's so many options for a pharmacist to venture into after you graduated in your pharmacy studies. Yeah, second question, Professor Tay. We know that there's a lot of pharmacy school in Malaysia. Yeah, there's so many. Why a candidate need to consider Segi University? Can you elaborate advice on this matter?
Oh, because
Thank
I
you.
run the faculty.
Ah.
No, okay. Put it into a very kind of like a diplomatic way. Okay, in terms of knowledge, scientific knowledge, professional knowledge, as a pharmacist, we have a framework by pharmacy board. These are the area of knowledge that we must cover. So whichever pharmacy you go, it probably wouldn't make a lot of difference at the end of 4 years, the kind of knowledge that you gain. But what I would like to emphasize is, why Faculty of Segi, Pharmacy in Segi is, I actually emphasize a lot on skills and competency as well as application of knowledge.
So skills and competency, you emphasize on that, yeah? Okay, we'll take note of that.
You may have the knowledge, but you do not know how to apply in practice, how to deal with patients, pass on your knowledge, translate into the patient's layman.
This is very important, Professor Tay.
Because to be a good pharmacist, you must have the ability. Okay.
Of course.
Skills and competency, from simple things like communication skills with patients.
Communication skills, yeah? Okay.
Counseling the patient, how to take their medications. Yes, all these are important skills and competency that any student or graduate must have in order to be able to serve the public.
We are talking about a balanced pharmacy then.
Yes,
right.
All round.
Who are not only good in theory, but also their communication skill.
Yes.
Right.
So what we do in terms of how we actually equip or develop our student is we actually go by phases, from year 1 all the way to year 4. We actually have a lot of hands-on session. We also have a lot of, learning in simulated environment, as well as, experiential placement in the 3 major areas, hospitals, community pharmacy, and drug company that I was telling you earlier. And why simulated learning in simulated environment is very important, because a lot of graduates, upon graduating, they are in a workplace, they will have a shock in terms of like, the stress, the pressure they're under. So we want to train our students, graduates, to be resilient as well, to be able to take challenges, to be able to handle stress and all this.
Right.
Because imagine you work in the public hospital, we are having so many patients waiting for their prescriptions and all these, they're impatient, and you're working under the kind of pressure. So how to actually train your student to work in that kind of environment. So all these are actually very important.
So you train our students on these matters as well?
We do a lot. We like to go for variety of teaching and learning activities, because every student have different ability to learn. Okay. Some can read and they can learn. Some they like to have hands-on and learn.
Right.
And we emphasize a lot on small group learning, because small group learning, you can have attention for the students. You know their strengths and weaknesses. You can give them a lot of opportunity to actually strengthen their weaknesses, or give opportunity for them to further strengthen their skills and that they already have.
All right.
So these are very important. So we have a lot of case-based workshops, we have problem-based learning. We have a lot of pharmacy skills development session that will engage simulated patients to come in. So the student will act as a pharmacist on that day when the patients are in.
All right.
Okay.
All right.
So all these are very important, because anything to do with skills and competency, you have to keep repeating the work.
Of course,
so that
of course.
It cannot be a one-off session and you say I'm good.
Of course.
Yes.
Yeah, you need to go through the practice on and on and on and on, to become better indeed. Very good. Thank you.
And our assessment method is also, tailored towards outcome based. That means, let's say if I want to assess you on communication skill, I wouldn't give you a written paper. I'll probably give you a role play session.
Oh, that's
Or
brilliant.
a patient in front of you. So
a real life scenario,
yes.
All right.
So these are all very important, and having the right teaching and learning activities and assessment. This is how you can measure the outcome to see whether you actually achieve the outcomes that you want.
So this is some of the strong points for students to join Segi there. What can simplify for all the strong reasons they gave? There's a lot of trainings.
Yes.
Yeah, a lot of experiment.
Yes.
A lot of practical, and you are stressing on competency.
Yes, competency.
Right.
So to also to ensure that all our students, because my motto is I want my graduates to be ready to serve as a pharmacist, not ready to be trained. They want to be training. Okay, because a lot of graduates, they say, okay, I have 1 year of pre-reg training, so let me be trained up during that year.
Right.
But when you're in the workplace, okay, you want to be properly trained,
Of
it is
course.
impossible.
We want you to be a real pharmacist, right?
Exactly.
Yeah.
Even though they are not licensed pharmacists,
Right.
but they can work as a pharmacist under
Yeah.
supervision of a registered pharmacist.
Yeah. And where are you from? You're from Segi University.
Yes.
Yeah.
So I would say we are very proud of our
Oh,
graduates
nice,
at this
nice.
moment in terms of the skills and competency. They may not be first class students, but in
Yeah.
terms of skills and competency, I would
Right.
say that many of them are first class.
Yeah.
Okay.
But it's good to be a first class student, but being competency
Yes.
is very, very
But
important.
put it this way,
Yeah.
the best pharmacist does not mean it's a first class.
Yeah, I agree.
Okay.
I agree.
So, talking about the placement that you talked about just now,
Mhm.
we arranged the placement, experiential placement in hospital, community pharmacy, and drug company in the final year. Okay, the very,
So it
very
takes place
simple.
on finally, which
Yes.
is year 4. Yeah.
Yes,
Okay.
for very simple reason is because I like that to be as a opportunity for students to fill in any other gaps that they still have,
Mhm.
before they graduate.
Mhm.
And also there is also career opportunity for students because they are close to graduation.
Mhm.
So these are where some of my students actually get offer for employment because
Wow.
especially from private sector, they think that this is a nice student in terms
Yeah,
of behavior,
right.
skills, competency, so they actually offer them
Yeah.
a job during placement.
Right. They're looking them as an asset
I
for
do,
the company,
yes, I
right?
do have quite a number of students who get a job offer during their final year as a student.
That's brilliant. Yeah.
And of course, if it also helps the student decide where they want to go, whether they want to work in hospitals or community pharmacy or drug company.
Right.
Because in year one, when they come here, you ask them, they have no knowledge about all these career options.
Right.
So at the end of the placement, it gives them a very good idea how
course.
working in hospital or community pharmacy or drug company is like.
And
So it
which
helps them in
which
career
industry to
option.
choose?
Yes. So
Right.
it helped them in the career, decision
Oh,
as well.
very nice. Very
So
nice.
we actually put that in the final year.
Very good.
And
Very good.
one other important thing that we do is actually our final year research project. Okay, if you look at the website and all this, we do have a lot of final year research students go for conferences, poster competition,
All right.
and they win awards.
So
yes.
our students also do research.
Yes.
Okay.
And it's individual project and hands-on research.
Okay.
There's also opportunity for collaboration, and they also go to our partner universities like Japan and all these for research, project exchange. Okay.
Okay.
So this is opportunity that we provide for the students.
Okay. Very good. Okay. Well, Professor, thank you so much on the question number 2. Professor Tay, in which year we started our school, pharmacy school, in the university?
Okay, if you talk historically, we started with farm training with the UK. So if you look at our setup in terms of facilities, our lab facilities, actually very much UK standard.
Okay.
That is the advantage to our students.
Okay.
If you talk about Bachelor of Pharmacy, our own homegrown program, we started in year 2012.
Okay.
So
we're talking about 11 years, our own grown pharmacy program,
yes.
And yes, since it is 2000, so we have so many graduates already,
we
right?
have a few hundred graduates.
Very nice. And can you share some success stories of your graduates, Professor Tay?
One of them recently in contact with me is actually I have a graduate who only worked for 1 year in Penang GH.
Penang Government Hospital,
she applied to work in China and competing with 400 over other pharmacies, and she got the job. There was only one vacancy.
Brilliant.
Okay. Nice. So she's now working in Shanghai, I think private international hospital. Yes.
Okay.
Yeah, she's coming back to Malaysia just for a short holiday, but she is one of the graduates that we're very proud of because it's not easy competing 400 over pharmacies, to get a job there. And she's very well paid over there. Yes.
It's not easy to get a placement to work in China.
Yes. Okay. She's very happily working there, and I also have graduates in Canada. I have graduates in Australia and many other countries.
Oh, that's brilliant! So they're everywhere now.
Yes, they're actually everywhere.
Right.
And in Malaysia, you literally can find them everywhere, from community to hospital. So it's convenient, sometimes we need like access. Let's say somebody in Malacca GH, I'll just call my graduates. I say, I have a friend there in Malacca GH. Can you go have a look after the person for me? Yeah. So it's very convenient and handy in that sense. But what I want to say is, our graduates are everywhere, and the pharmacies are still in demand out there. And ultimately, I think to be, competitive, you still need that skills and competency in you to be a good pharmacist.
Oh, very good. Thank you so much, Professor Tay, for the sharing session today. Coming from you, from an academician and also from the industry, thank you for your valuable information and knowledge. Viewers, ladies and gentlemen, our pharmacy school is in existence since 2011. It is actually a 4 years bachelor program, which is run 100% in Segi University. Kota Damansara. Of course, most of you SPM leavers who are considering what we're going to do, you can actually consider pharmacy program, okay? Because as what Professor Tay mentioned earlier, there's so many options in industry that you can venture into after you graduate. Okay, thank you so much, Professor Tay.
Most welcome.
Thank you, audience. We will see you again in another few more minutes for our next session with Graduate School of Business. Thank you so much, Professor.
Before I end, perhaps I would just like to invite anyone who is interested in pharmacy program, come and visit us, come and talk to us.
Oh, nice.
Yes, you can come and view our facilities,
yeah.
meet my lecturers and students.
Yeah. Available every day, Professor Tay?
Yes.
Oh, yes. Yes, Monday to Sunday.
So long it's not midnight.
Okay. Thank you,
All right.
Professor Tay. Thank you.
Yes.